Hello everyone, my name is Lenore Kubasarian-Mazenko and I'm one of the co-founders of MedicarePlanDiscounts.com. Today I want to talk to you about Medicare Part D or prescription drug plans. So one of the biggest surprises that people get when they first become eligible for Medicare is that they actually have to enroll in a separate prescription drug plan outside of traditional Medicare Part A and B. Today I'm going to show you how you can actually do that all by yourself, but please, if you want help, don't hesitate to call us at 844-280-1985. Our service is completely free to you and we'd love to help take care of you so that you know you're in the right prescription drug plan. So we're going to go through 7 things pretty quickly today. We're going to talk about what a prescription drug plan is, how a Medicare prescription drug plan works, when you can enroll in a prescription drug plan, what you'll need to get started to enroll, how to use the online plan finder, things you'll want to consider when you choose a plan or you're changing a plan, and finally I'm going to show you how you can actually enroll. So what is a PDP? Well, a PDP is actually an acronym for Prescription Drug Plan in the world of Medicare. Prescription drug plans are known as Part D. Medicare uses private insurance companies to run these prescription drug plans. They have to follow very specific rules and guidelines that are set up by Medicare. So it's important to know that that's for your protection. So how do they work? Well, Medicare offers prescription drug coverage for anyone that has Medicare. Typically, you'll have to pay for the prescription drug plan, but it's offered to you. Even if you don't take any prescriptions now or when you first become eligible, you really should consider joining a plan, because if you decide to join later, you'll generally or typically have to pay a penalty for late enrollment. So you don't want to do that. You want to make sure you sign up when you come off of credible health insurance. So how do you enroll? Well, or actually, I'm sorry, when do you enroll? You can enroll when you first become eligible for Medicare, or when you first come off your employer's group plan, a union plan, your spouse's plan, when you lose your health coverage and you're going on to Medicare Part B. That's when you should actually enroll in the plan. That's known as your initial enrollment period, or IEP. Okay? You can also change your plan or enroll during special enrollment times. Typically that's when you move, or if you're going into a skilled nursing facility or long-term facility. Now you can change your prescription drug plan every year during open enrollment. That's October 15th through December 7th. When you're choosing a plan in that time frame, it becomes effective the following January. So you're kind of stuck in that plan from, you're stuck in the plan from January 1st to December 31st. And then you'll be able to change again for the following year during the open enrollment period. Now, some of you may qualify for extra help. That's when you can also enroll without any penalty. But to see if you actually qualify, you can call the Social Security office at 1-800-772-1213. They'll send you the paperwork, or 1-800-Medicare. Those are good places to start to see if you'll get some assistance for your drugs. Okay, so if you want to get started on choosing a plan, here's what you need. You need to know your address, your zip code, and the county you live in. You'll need your Medicare card, a list of your prescription drugs, and the dosage, like how much you're taking, how many times a day, how many pills are in a bottle. You want to make sure you have that all in front of you before you sit down to choose a plan. You'll also want the name and address of your pharmacy and maybe an alternate pharmacy in your area. So if you're ready to get started after you've gotten all that information, you're going to do this online by going to Medicare.gov. They have a really great tool on Medicare.gov. You're simply going to click on this nice big green button that says Find Health and Drug Plans. When you click on that button, it'll bring you to the screen. It's going to ask if you want to do a general search or personalized search. If you do a personalized search, you'll be able to save your information and go back and look at it and make changes. Otherwise, if you do a general search, you'll just wind up re-entering your drugs every time you go in. So either way, you're going to click on Find Plan here or down this way. The other thing I want to point out is that Medicare has some great online tools. This is known as the Plan Finder Multimedia. There's some videos, 5 specifically, that talk about how to use this plan, and then there's some additional tools down the right side of this screen that you can use to learn about choosing a prescription drug plan. Okay, so this is the shortcut version. Once you click on Find Plans, you're going to come to the screen, how do you get your Medicare coverage? You're going to need to let them know whether you have original Medicare, whether you're enrolled in a Medicare Advantage plan, or if you don't have coverage yet. You're going to click on one of these radio buttons. We've clicked that we have original Medicare with a Medigap policy. It asks which policy, a Medigap policy Plan G, and then it asks the premium. You don't have to put it in there, it's optional, so we didn't. And then it also asks if you get any extra help from maybe a PAD or state agency. You're going to put that in here. We don't get any extra help. So then we're going to go ahead and click on Continue to Plan Results. We're going to click there. If you're not taking any medications, you see the first arrow that says, I don't take any drugs. You're going to click there. But if you're like most people enrolling in Medicare, there's 1 or 2 that you're on, and you're going to start typing the name of each drug in this spot here. Once you type it in, it has a little bit of an autofill. It'll ask you if that's the drug. You'll click on Find My Drug. So I started to type in Synthroid. This is what came up. It asked me specifically for the dosage. It'll default to the most common dose. It'll ask you how much you're taking, how often you're taking it, and whether or not you get this at a retail pharmacy or a mail order pharmacy. And once I put that in, I'm going to click on Add Drug and Dosage. Now you can see that it automatically brings me to a screen that says there's a generic drug available. So if there's a generic drug available, I strongly encourage you to make sure that you talk to your doctor about using the generic drug, because you will save lots of money by using a generic. If that's not possible, you're going to make sure you click on Use Name Brand. Otherwise, you can go ahead and click on the lower generic brand if that's what you use. So we're going to hit Continue here, and you can see that I've added a couple of other drugs. This is a generic Synthroid. Then I added a metformin and another medication that's commonly used. I also let the system know that I'm taking 30 a month, 60 a month, 30 a month. So that came in the screens previous. You can see it asks me how often I get it filled. This gave me some generic options. It gives me some options to change and add, but I'm going to go ahead and click on that my drug list is complete. Okay, so now the system wants me to choose a pharmacy, and I strongly recommend that you choose more than one, because different pharmacies have different relationships with different insurance companies, and you want to make sure that you're giving yourself the best choice. So I went ahead and clicked on Walmart and Walgreens. Those are 2 popular chain drugstores in my area, and I'm going to go ahead and click on Continue to Plan Results. Okay, so now we are in step 4 to refine our results. It's asking me if I want to update my plan results, if I want to limit my monthly premium. All these things down here you can take a look at, but for the most part, I'm going to click on Prescription Drug Plans with Original Medicare. There are 21 plans available. I checked this radio button. I can also, up here, I can also change and update my search if I want, but I'm ready to look at what's available to me. So I'm going to click on Continue to Plan Results. This is what comes up. This nice N means that the plans that are available are national. There may be some little other circles here with some of the plans available. So it tells me again that I have 21 plans in my zip code. Okay, and it lists the most favorable plan for me based on these drugs to the least favorable. So it also has this nice button here that you can click on if you want to see that plan, or if you want to compare plans. It lets you compare up to 3 plans. So that's what I did. I compared the 3 most favorable plans for the drugs that I selected, and I'm going to go ahead and click Compare Plans. So the 3 plans appear. This is an AARP Medicare Walgreens, a WellCare, and a Humana Walmart plan. They're all available to me. If I want to enroll right now, I certainly can, but I don't encourage you to enroll at this point. You want to take a look at the plans. There's different tabs here. You want to compare them. I'm going to click on drug costs and drug coverage, and I'm able to see the different monthly premium as well as the cost of the drugs if I enroll in January through December. Okay, so I'm going to click forward again and specifically look. I'm going to scroll down, and when I scroll down again, this shows me the 3 different plans and the cost. So this is the cost of my monthly premium along with the cost of each drug. Now, I know that this drug company on the right was the cheapest monthly plan. It also offers the cheapest drug cost to me. So that's probably the plan I would choose. I scrolled forward and specifically looked at that plan, and when I did, it tells me that with this company, the specific cost of the drug is $1,420, $550, and $1,150, and then it also talks about the deductible and the refill. So it gives me some specific information. There's a lot of information I could choose here, but this is what I need to look at. So if I hit the tabs up top here, it tells me what the advantage is to use a mail order program. It tells me that if I use a mail order, I actually am not paying very much for the drug. I'm actually paying a little less excuse me, than if I was to go directly to the pharmacy. I'm going to pay $17 a month in premium. That's highlighted in like a gray color, and in orange, that's the cost of my prescriptions for every 3 months that I'm mailing away for it. So prescription mail away might be a great option for me. If you choose to go to the pharmacy, you can. Okay, so the next thing I want to look at is how to enroll. Some other things you'll want to consider before you actually enroll is if you travel, you want to make sure you're in a national plan. You want to make sure that you have a drug store available to you wherever you travel. If you're taking any medications that you think you're going to go off, you may want to put those in and take them out to see how they affect the plan. If you anticipate getting any kind of surgeries down the road in the plan year, you can also add those in. Again, as I said before, you're going to want to look at generic versus brand name because generic is going to save you a ton of money. You'll also want to know where your drugs fall in the tier or the formulary. The lower the number, the cheaper the drug. That's the lower tier drugs are usually your generic drugs. That's really important. Now, if you're taking some high cost drugs, typically that's insulin or maybe a cancer drug or a arthritis medication, those are usually higher cost drugs. You probably will fall into what's called the coverage gap, and Medicare has some specific rules on that. This video is not designed to talk about the coverage gap. If you think you're going to fall there, please call us. We will walk you through that individually so you understand what the coverage gap is. So now that you get a basic idea though of how to use the online tool, we're ready to enroll. So what I'm going to do here is I'm going to click on this plan, this first plan, which is $17 a month. It's a 3 out of 5 star rating. It's telling me that my drug cost for mail away for the year, including my premium, is $347 a month versus if I go to a retail pharmacy, it's $366. But I'm ready to enroll. So I'm just going to click on this enrollment button, and it brings me to a 4-step process of enrollment. Now, this is some pretty basic stuff. I just, need to make sure I have my glasses. If I'm looking at a small screen or if I'm looking at a big enough screen, I'll be able to see, answer all these questions: my name, my address, my date of birth. It also asks for my Medicare information as it appears on my Medicare card. So again, this is some pretty basic stuff. It tells me, attention, you're enrolling in the 2017 Humana Walmart plan. And the thing about enrolling online is that once you click the OK button and confirm. It will send you a confirmation number. You want to make sure you write that down. You also, I recommend that you use an email address so it can send that information to you online as well. So that's really, from start to finish, the really high profile of enrolling in a prescription drug plan. Again, if you have questions, please call us. We'd love to walk you through this so that you can understand how to choose the right plan for you. Hope that gives you what you need. Have a great day.